Okay.
Too kind.
Hello, guys. Good afternoon, good evening, good morning, all over the world. My name is Lachlan. I'm with my co-host, Dr. Charles Duray. And on the other line, we have Dr. Dowse, Richard Dowse. What an honor to invite Dr. Richard Dowse to be in the podcast today. And right behind me is the topic that we're going to discuss about his recent book. It's called A Face, A Beautiful Face, written by him and his co-author. Uh, Before we dig in, Dr. Dowse, good to see you, Charles. Good to see you.
It's nice to see you
Absolutely.
again,
Thank you so
Locke.
much.
I've been on your podcast before, and I've always enjoyed them. Thank you.
Thank you for coming back, sir. Charles, good to see you.
Same. It's always an honor and privilege. You're very authentic, a good human being, and I think that's why we're with you today because we love what you do and you speak the truth and you are honest and integrity, and so we love to have that conversation. So, Richard, it's nice to see you again. We've talked before.
Yeah, Charles.
Products, you have wonderful products, and so yeah, this is great. Thank you so much for letting me join.
Good to see you again, Charles.
Yeah, same
Those
here.
those of you are not familiar with my guest speaker today, Dr. Dow, Richard Dow. Dr. Dow have been practicing dentistry more than 42 years. Now he's the author of the book right behind me is called The Beautiful Face book with another co-writer. Dr. Dowse is the founder of couple dental Maureen's product, and also he's the speaker and the teacher for the Sleep Medicine Academy. Dr. Dow, it's an honor to be with you. Can you give us a few background about your where you live and the history of your career of dentistry and where you are now?
Well, thank you, Locke. I'm addressing you from Dubuque, Iowa. It's cold here, but it always is in Iowa. Now it's been warm in the last few days, but generally it's very cold at this time of year. I grew up in Iowa. The only time I spent any time away from Iowa was 3 years in the Navy at the Great Lakes Naval Base in Illinois. But then I came back and now I'm settled in Dubuque. I grew up in central Iowa near Marshalltown. And so now I've been practicing. I practiced in Dubuque up until about 5 years ago, and then I've retired. And now I also own a couple of products companies. One is the Oraicare products, which makes a very popular and growing mouth rinse that is expanding now into the orthodontic care industry. We're just about to introduce a new toothpaste, which is a new cutting edge toothpaste made out of microcellular fruits fibers from Norway. And you'd think, well, what is that? What good is that? Well, when you see the statistics on it, you'll be absolutely impressed because it just does some things that no other toothpaste can do. And then I've started a new nasal rinse company, and I've created a couple of products there that are uh, uh, selling well. And and then I wrote this book. The book, all these projects that I'm doing after my retirement are geared towards my mission in Haiti to build a clinic there. So I send money there, and we're building up a fund, purchase a building. I have dental equipment down there ready to go. We want to build a clinic in Haiti that will train dentists, destination education. It's upper in northern Haiti where it's less violent, and we're protected by a church NGO. So that's what I'm up to, and these projects are all geared to supporting that clinic now that I am retired.
Wonderful. Dr. Dow, so how did you on your journey? How did you get involved with sleep medicine and derive this from your experience writing the book as well? So how did you start experiencing the sleep medicine product?
Well, I started that 17 years ago, taking a course in Omaha. I learned about my own snoring, which was so loud that it actually caused my wife to lose sleep, and I didn't know it was harming her health. I didn't know it was so serious until I went to that course. And not only was it bad for my health, but it was affecting the health of my spouse. Probably affected the health of anybody who lived near that noise because they can't get into that deep stage of restorative sleep. So I began taking using an oral sleep appliance, and it did well for me for about 15 years. That oral sleep appliance kept me into normal range of parameters that we consider uh, a normal, a healthy person when they're sleeping. But then it began to lose ground. And then I started looking for other therapies like the night lace, the Excito SA, the Bongo RX, EPAP therapies, oral myofunctional therapy, and a number of other products that were helping me with my sleep apnea issues. And eventually I got to the point where I had to use a, um, a CPAP. But because of that, I teach at the Air Institute in Portland. It was started by Jeffrey Skinner and Terry Coddington, and I teach on the nasal hygiene portion of that curriculum. I started an online teaching platform, which is Sleep Balance Academy, and that is to train dentists and chiropractors in sleep medicine. And out of that, I did a TV show called The Doctor Sleep Show. And the producer of that show and the owner of that station suggested I write a book. So about a year and a half ago, I began writing this book called Beautiful Faces. And the reason it says Beautiful Faces is because if we found that if you try to do something other than CPAP for a patient. In other words, dentists can expand the arch and bring the lower
Really?
jaw forward. We improve a patient's because we get them back to their genetic potential. And we're not growing to our genetic potential. If you look at me on this picture right here, you'll see I'm a severe dolichocephalic face shape, and I have and I also had four bicuspid extractions with orthodontics,
Yeah.
which means that also shrunk my tongue space.
Mm.
So all of these factors together made my apnea worse, and I began to say we need to do something about that. And I wanted the people. I wrote the book for the public so that they would understand the transition we have gone through to bring people back to a state of health that does it more naturally and rather than just forcing air into their lungs with a machine that blows air into your mouth and nose.
That's
So that's
beautiful.
what the book is about. So the book is about we're saying that if you improve the structural airway, the opening and the allowance of the airway, it will also improve the natural beauty that people were supposed to have when they were born. So we call it an epigenetic potentiator. And and dentists are the only ones who can really accomplish that the most efficiently and most of the time without surgery.
Also awareness, right? Because the other doctor's not necessarily looking at it. They're not educated in that.
No, they're
So,
not. That's
yeah.
exactly right.
So
The
you're the
book
first
is
point of
written for the
contact.
general public, Charles,
Yeah,
but
I love that.
it's also written for the dentist because if the patients read this and they go back to their dental office or their medical office, they're going to know more about sleep medicine than their physician or dentist does. And
Well,
that
even the medical
should,
doctors, you could give this book to the
yeah,
medical doctors.
that's
Yeah.
exactly right. So they're going to come
Cool.
back, and then that's going to prompt my feeling and my wish is that will prompt us dentists, the chiropractors, the physicians, the nurses, everyone to begin to look into this more closely and upgrade their knowledge in this area of science.
I think that's fantastic. And I have, by the way, I have apnea too. But I
Yeah,
took the home
yeah.
test and it was not very valid. And then I finally went to a sleep test and I found that my O2 saturated all the way down to like 20%. Not only snoring went down so low. And if I only knew that, I didn't even learn that in my curriculum. I took 100 hours and I still didn't
Mhm,
understand that. But now I do.
mhm,
And so I
mhm.
think those are little viable keys that doing that. Do you have any TMJ problems from doing the mouth appliance for so long or no?
I have not. I had a little bit of trouble maybe 10 years ago, but
Okay.
it's resolved. But I would like to open my bicuspid areas up that where I lost, press my teeth forward. You'll see pictures of myself in the book that actually show me going through braces and all my journey of treatment uh, that that caused some of my problems to be worse. Now I would have had apnea anyway because I have a narrow arch and a high
Sure.
arch, very high palate.
But maybe if you
So
had palatal expansion and you didn't have the bicuspids out, you'd be better off. You have straight teeth now, but straight
I
teeth,
think I
better
would be a lot better. I would be a
right?
lot better off.
Yeah.
Yes, I would. So that would make a huge difference. So the subtitle to the book is The Architects of Enhanced Attractiveness and Improved Human Breathing. So that explains Beautiful Faces. Beautiful Faces is the main title, and then the subtitle is The Architects of Enhanced Attractiveness and Improved Human Breathing. And in there, we also have different we have a lot of stories. One was a little child named Ridge. His name is Ridge. I love that name. And he was a 6.5-year-old in Colorado who went through sleep apnea. He became so violent that he actually was hammering through the bathroom wall, actually through the bathroom door with a hammer to get at his sister to harm her. Okay. You don't realize what sleep apnea can do for children. Makes them
Mm.
hyperactive rather than sleepy like adults do. Now, a number of adults get
I've
hyperactive,
seen that
but
before. I had a girl that had
yeah,
that. That
yeah,
had Venus pulling in the eyes, and she
yeah,
actually had a tumor in her back, her this auditory area this way,
right,
and so
right,
basically, she was doing poor in school, and it was wound
yeah,
up because of oxygen
yeah,
saturation. So it's
yeah,
amazing.
yeah. So, did your oxygen saturation index get down to 80, Charles? You
I went
said you
down to
said
like 26% oxygen. That was like it was like so far low, it was ridiculous. Not for a long period of time, right? But it was
26. I've never heard of anybody going down that low.
I don't know. They did a study and
Uh,
they had it. The O2, it was
mm,
not, it was like a function of like seconds or how long, but basically I had a certain apnea AP, right, the index. But during
mm,
that time that it went down to a very low O2 sat.
yeah,
Not like just like percentile they gave me. And so I'm wondering how you quantify that. I know you have the ring that you have,
well,
but
yes.
I don't know what's the lowest you can go down. And if you go down to really low, can you pop back up quickly? What if you go down for a period of time?
There are people that die in their sleep. Okay.
There you go.
Okay. There are people that die in their sleep. Now, it could be the stress of sleeping and trying to get oxygen. Really, you need to call it sleep suffocation. It's not. Sleep
That's
apnea
true.
a name that is not very impactful. Call it sleep suffocation. Call it what it is. Sleep suffocation is what I name it in the book, and it's what Dr. Zelk told me.
Never
And
heard that.
he's a sleep specialist, but this is sleep suffocation. You either have partial suffocation or complete suffocation events where no
Well,
air is going in at
is
all.
that one from the apnea or is that from your wife when you're snoring that she puts the pillow over your face?
Yeah, well, yeah. I think the machine would record that as an apnea event, and we wouldn't know the cause of it.
Yeah.
But yeah, no,
But
yeah, I
I'm sure
mean,
your
you've
wife
seen
pushes you
people.
too. My wife pushes me. She goes like this
Oh
and
yeah,
to wake you up.
they elbow you or poke you
Elbow,
or
yeah.
yeah, and then that also keeps you from you yourself
Yes.
can't get into the stage 3 and stage 4 sleep. Um, Stage 4, you generally that's a deep stage of sleep, and you get restorative sleep for your body, physical. In the REM stage of sleep, which is stage 4, then you get more restoration of your mental health. So the two together are very important, and those are also the stages where some of the lymphatic system works, where the brain actually washes itself of toxins. So it's a very dynamic thing. If you want to know more about how the brain functions, you should read uh, uh, Walker's book on why we sleep. It's a fabulous book. I highly recommend that book. Okay,
So it's not only
so
beautiful faces, it's beautiful mind.
that's a very, very, very true statement, Charles. I agree with that very much so. Thank you. Um, Mental health is actually quite severely impacted by obstructive sleep. As a matter of fact, I wrote in the book that if practitioners like dentists and physicians and all medical people would rule out sleep apnea before they do any
Wow,
kind
look
of
at that. Yeah.
heart surgery, stroke
Yes.
therapy,
Stereo.
diabetes work, all that stuff. If you just screen out the sleep apnea with a simple test and rule that out first and get that treated, we could avoid maybe 50% of our national costs of insurance right now. We
That's
Dr.
from
are,
improper
we are,
diagnosis and improper awareness,
we're
Doc-
right?
sinking.
Dr.
Yeah.
Dow, I love that.
Yeah,
Can you repeat again and explain to my audience again, including the general population that listen to our discussion here, as well as the doctor and the dentist, the chiropractor? Well, you mentioned something really powerful, like
yeah,
if before the physician or the surgeon doing any kind of surgery, whether it's heart, lung, kidney, doesn't matter, but the
yeah,
diagnosis of the sleep problem is the biggest, one of the biggest
yeah.
Huge.
Let's
contribution
take,
factor for
yeah,
the
yeah,
destruction of the body.
that's
And
right.
why? And why?
This,
Yeah.
I agree. Thank you. Let's just take, yesterday I was at my men's Bible study group, before church.
Amen.
And one of the people there was talking about his friend down in Arizona who has extremely bad GERD. The GERD is so bad the that he can't sleep. In other words, he's just beside himself,
Yeah.
can't control it with anything. And one of the causes of GERD is sleep apnea because people are trying to,
Yeah.
to breathe, and they're bringing the acids up their esophagus into their esophagus and their mouth from
Cause
that.
cancer too.
It causes cancer too, by the way. So I said, has he been checked for sleep apnea? I mean, at least it ought to be ruled out as a cause. Nope. I said,
Fantastic.
well, it's such a simple thing to do. Do a sleep study on him and see if that's the cause, for crying out loud.
Right.
I mean, and that's what's not being done. Now, there was a Wisconsin cohort study done quite a few years ago in Wisconsin. We're talking about medicine. And they were doing a study, the scientists were doing a study on sleep apnea. Okay. So what they did, now I'll get to what you asked me in a minute, Locke. Okay, just a minute. So they had maybe like 20 or 30 patients in this study. They did their test, then they sent them back out into the public. Guess what? Every one of them had sleep apnea now. Okay. They sent them back out of the public, and then they checked with them 10 years later to see if they had ever been treated or diagnosed with sleep apnea by their PCP, their primary care physician. Almost none of them had been diagnosed with it. They were all being treated for diabetes,
Yeah.
stroke, heart disease, cancers, GERD, whatever it might be, and they
Yeah.
were not getting at the base cause or one of the base causes. So this kind of roundabout goes to what you're saying, Locke, and that is that if we could get people to start paying attention to this, a simple treatment
Root
that doesn't
cause.
require pills and surgery, we
Yep.
could cut our healthcare costs in half in this country. I'm totally convinced of it, and that's why I want to get a hold of Mr. Kennedy and tell him I want him to
I,
read the
I
book.
got I got that connection for you, Bob Kennedy Jr. I got it. So we'll make
All
it
right,
happen.
let's make it happen.
But there's no
Yeah.
money for pharmaceutical companies or for hospitals then if you do that.
Well, too bad. Too bad.
Uh,
And I don't think physicians and hospitals are that cynical. Uh,
no.
I, I I hear
Well,
people say that.
pharmaceutical.
I don't believe it. I
Yeah.
think it's just oversight. It may be constraints of insurance. It may be just habit. I mean, look at dentists. When I went to school, and even 10 years ago, they weren't getting any training in sleep apnea treatment. They weren't getting any. And why?
Right.
By the way, why are dentists involved? Is because sleep apnea causes teeth grinding and
Oh
TMJ
yeah,
problems.
big time.
And
TMJ.
so that's exactly
Yeah.
right. So we have to be involved because we're breaking off our bridges and our implants, and they're failing. And I didn't know what the reason was on some of my patients. Now I realize it. Instead of dentists are giving shots of Botox to the masseters, and
Right.
they shouldn't be
Through
doing that
toxins.
because you make the sleep apnea worse. If you give a Botox injection to stop grinding, when the grinding is actually tightening these muscles, and what the grinding is doing is opening up the airway. Give me a break. And then you're going to stop that? Okay, I mean, let's just check them for sleep apnea. Why don't you do that first? People with insomnia, a lot of insomnia is caused by sleep apnea. So
Right.
why are we going through behavioral therapy, uh, and medicating for insomnia when we don't check for sleep apnea first? I mean, it's just
Doesn't make any
logical to
sense.
me.
That
Why
doesn't
don't
make
they do
any
that?
sense.
So this is what this is what the book is about. It is about changing this mindset of leaving this go. And I see the background behind you locked there of people. I mean, we're doing strokes and heart surgeries and cancer surgeries, and we're spending money on kidney dialysis because of the high blood pressure caused by sleep
Yep.
apnea. And here's all that stuff might be cut in half if we just got people to start testing for sleep apnea. And and I just saw one of my friends up in Washington, whose whose patient was diagnosed with an AHI of like 6.5. The physician says, yeah, he has mild sleep apnea, but he doesn't need treatment. I'm oh my
That was me. That was me.
no,
So
no, you can't do I even even upper airway resistance syndrome needs to be treated at an early stage so it doesn't progress. I mean, why would you wait till it progresses to the moderate stage before you treat? Why would you do that? Why not just there's simple treatments and the
well,
dentist have it. The oral sleep appliances is one thing you can do with mild sleep apnea. It hardly is uh, well, it's a lot more tolerable and a lot more used than is a CPAP. CPAP's got 50% use, and what they include in that 50% is that the criteria for success for a CPAP use is 4 hours a night.
exactly.
So a guy can wear it or a woman can wear it for 4 hours, throw it off, suffocate for the rest of the night's sleep, and that would be considered a success. Give me a break. And so, and even at that point, even with that generous measurement, they still only have 50% success rate, and that's maybe within the first year or two, and it drops off after that. It goes below 50%. So that's not working. Okay, we're not working now. Those Locke just showed some different types of sleep
Fine.
appliances. There's more than 100 of them right now, and the list is growing. But many of them are quite comfortable and they
Do you know
do the
what?
job.
Do
Yeah.
you know what I
Go ahead.
love? Can I edify you a little bit here? One,
Yeah,
first of
sure.
all, you can see someone's passion by the way they talk. Okay.
Yes.
And
Yeah.
you are having that passion and purpose. Okay. It comes out very loud and clear. The
Yeah.
other thing I want to say to you is that you're coming to the root cause of the problem because you're not only saying, buy this appliance, buy this CPAP, you're saying, let's educate you to know what you don't know. And maybe
Yeah.
you want to make something different about it first. And I love that. I
Yeah.
don't know anybody who's really doing that because it doesn't do any good if the doctors are screening for it and they're not using it and the general public doesn't know about it. And so I
Yeah.
think that's a really cool thing. The other thing is you're solving problems. Like when I had problems, and I know a lot do the same thing. I know you guys think the same way I do. If you have a filling that's out on the class 5 or whatever, and you fill it back again, but you don't know why it's caused by interference, then you're just
Right.
debating the problem for a period of
Right.
time, short time.
Right.
So
Right.
you're looking for long-term solutions, right? For this stuff.
Exactly. Matter of
You
fact, if
know,
you catch children at an early age, if they could have caught me at an early age, put me in a mile muncher or a mile brace or some kind of functional appliance that expands the arches
right,
naturally,
right.
um, and began to develop my jaws wider and opening up. Not only does the jaw widen, but the nasal area opens up because the roof of the mouth
True.
is the floor of the nose. So when you open that suture up, all of a sudden you have airway in the mouth and you have airway in the nose, both opened up. And when you widen the upper arch, note what else happens? Your lower jaw comes forward. Okay,
Naturally.
because you widen it, and now the jaw has to come forward to reach to match the upper width. Okay, that's how it does it. And you can also upright the lower molars. We're not expanding the lower arch, we're actually uprighting the lower molars. So together, the forward jaw movement and the uprighting of the lower molars matches the upper jaw expansion. It is really amazing what we can do. We've actually, and I'm not I've been cautious about saying this word. We actually cure sleep apnea. Now, I rather than say that, I've been instructed to say we reduce their AHI scores and all the parameters that we measure for sleep apnea, all those can be reduced to normal range. So that's a better way to say it than cure. Okay. So, and Vivos has paved the way for that, Vivos Therapeutics, because they're claiming that 25% of the people they treat, adults, can get off of any kind of nighttime treatment whatsoever. Zero.
That's beautiful.
Imagine that. And no one else
Oh, you know
in
that can
any
cause
other,
long-term
no
dementia
other
too.
profession is doing that.
You know
No
that.
other profession is having that happen but dentists.
Alzheimer's. Yeah.
Okay. That's I think that's mind blowing. And when you think you can do that and save healthcare costs and the misery and the pain that it causes in this country, imagine what this book could do. So that's why I think this is important, because all the other books that we talk about now we've got some really amazing people in here, Jeffrey Skinner and Terry Coddington and Felix Lau, uh,
So it's a collaboration
Cameron
book.
Fata,
Yeah.
Cameron Fata. They have their cases in here, and you can see the results. They have the statistics to show that they're actually getting these results. They have all the measurements, the parameters, and the data are there. Okay.
So the Bible of
Yeah,
sleep medicine.
I'm
For the common person, right?
so I'm passionate about this.
Yeah, I could see that.
You can
We could
see
see
it.
that.
Okay.
I see
Okay.
it. Yes, I see it.
All
I
right.
think, and the reason is because it's such a big deal. And
It is.
I understand because I have them myself. So,
Yeah.
and by the way, one thing, even if you don't have a sleep appliance and you don't mention sleep app, if your wife is snoring and you're hitting you like this,
Yeah.
does it matter? You need something to get rid of that. All right.
Yeah, you
So,
do.
you know,
By the way, you can wear an oral appliance with a CPAP. So sometimes if you put the oral
you can do
appliance
combo
in,
therapy.
then you can
Correct.
reduce the pressure of the CPAP, and then the CPAP becomes more tolerable. So there are lots of things we can do, and we teach a lot of things that weren't done in dentistry, EPAP therapy and Excite-OSA, um, night lace, which is a laser that is used to shrink the palate and raise it up, and also explode the fat cells in the tongue to shrink the tongue. So we can actually, with the laser, not cutting it, shrink the tongue and raise the palate with night lace. And that has been taught and pioneered in this country by Harvey Schiffman, who is an amazing practitioner. I took his course in Las Vegas many years ago when he was first starting out, and that is growing
What about two
amazing.
second test about putting your finger on your nose and breathing on this side, breathing this side, and looking
Yeah,
in your mouth to see
that's a
that
good
there's
idea.
poly, how much the airway is restricted? How often do
Yeah,
doctors do that? Never.
they
You
don't.
know,
And
good, right?
even the Codle maneuver, which is this,
Or you pull it up, right? Yeah,
hold out
yeah.
on the
That
side of
makes a
your
huge
cheek
difference.
and
Yeah.
then and see if it helps their breathing. Well, if it does, they should be using a nasal dilator, okay, and a nasal spray,
Anybody
because
right now watching, right now, can take their fingers, pull it up like this, check the
that's
breathing versus this, and you could
that's
do it real quick.
yeah, yeah, it's
If you
called a
see a
Codle.
difference, you can get a
It's
nasal
called
strip, correct? A
yeah,
nasal
yeah,
strip.
you can do it. Nasal strip or the nasal aid. I prefer the nasal aid. It's a
You have
device.
one, you have one that you did. What's it called? What's the company called that you did? Yours? You have one yourself, don't you?
Well, I work with with the person who makes the nasal aid,
Okay.
Michelle Lovato, and she's amazing. She's yeah, she's working with me on with the nasal spray. We're going to develop some more products
Okay.
with Michelle. But anyway, yeah, a nasal dilator is a simple thing you can do. Nasal strips work. I've seen nasal strips work too, so that's fine. But nasal dilator might be a simple solution for a lot of people. If you don't want to seal, and this idea of taping the mouth shut,
Yeah, I was going to ask you.
bad
Yeah.
idea, bad idea. Unless you can breathe really easily through your nose, then I wouldn't do it. But if you can breathe easily through your nose, yes, I think it's good to train yourself to breathe the nose. Breathing through the mouth is just an emergency hatch. It is not meant to be something that you do regularly. And you see people walking around like this, you know that there's something wrong with their breathing.
Never thought about that. Yeah.
Yeah, I
Dr.
see it
Darwin,
on TV.
let me go back to the basis slide, and can you explain to my audience uh, what the reason was when we diagnose a person have sleep apnea, uh, what is the basic science behind that is that the consequence of having these mild, moderate, severe sleep apnea,
Oh,
those basic science, like what are we talking about here? And
right.
the systemic approach, how do we approach the situation from the standpoint of view of a dentist? What do we do when we know a patient may or may have this condition? Well, what are we supposed to do, or how do we the
You need
training and
tests.
stuff like that?
Yeah,
Yeah.
talk about that.
That's a good question, Locke. So the easiest way to do this is in a dental practice, the first thing that you should do is issue a screening form. A patient should fill out a screening form. Everybody, everybody should fill out a screening form.
Great.
There's children's screening forms and there's adult screening forms. Now I've developed one with Sleep Balance Academy that I think is pretty useful, but there are lots of them out there. The Stop Bang, the uh, Epworth score is another one that is the insurance companies like. I think it's not a very useful product, but it's helpful. But there's a lot of screening forms you can do, and I would have that done. And then on there, if they get a certain score, you can say if you get a score of 6 to 9, we recommend you get a sleep study. So that's the way I do it because now the person can look at their score, and rather than somebody just saying, "I think you need a sleep study," I say, "Well, what are you? You're a dentist. What are you talking about? This is not your area." Well, you got to educate them a little bit. Most people are very uh, accommodating, and then show them the score, and they say, "Well, with this score, you have risk factors for obstructive sleep apnea. And we need to know that because we know, and I could see in your mouth, signs that you may have obstructed airway while you're sleeping, and that can cause all kinds of dental problems." So that's the way I approach it, Locke. Um, and so I use the screening form frequently. Now, you don't have to graduate right off the bat to a sleep study. You can do a home sleep study with one finger. There's single ones around. I can show you where what those look like on my websites. But if you'd like to see them, I'd be happy to do that. Um, but you can actually put them in a circle ring, which is a screening device, and get another score and say the ODI, which is the oxygen desaturation index, is 5 or larger. Then that again would recommend that they get a sleep test. So none of them are for sure uh, reasons to say that somebody has sleep apnea, but it takes them step by step to logical conclusions and more data so that they can more readily know what's going on with their own body.
So
You also
the,
asked
the
about the systemic complications like stroke, heart, blood pressure. You want to know about that too.
Yeah.
Yeah,
Well, let's say let's just say
you
this,
have it.
Locke.
Yeah.
The AHI score. What that means is the Apnea Hypopnea Index. That's how many times you suffocate per hour. Okay.
I
So
like
apnea is complete stoppage of breathing going in. In other words, you can't get any air in your lungs. It's closed off. A hypopnea is a restricted air. So it's restricted in a certain percent. The machine will measure that. And then there's a certain number of those per hour that you average together. And that gives you the index. We want to see less than 5 for a human being that is an adult. On a child, that's like 5 or 6 years old, it would be less than 1. Okay, so the children are more susceptible to these apneic changes than adults are. But there are gradients between that age and adult age. At age, if you have a score between 5 and 14, you're considered mild. From 15 to 29, you're considered moderate. And 30 or larger is considered severe sleep apnea. In other words, if you have 30 times per hour that you're suffocating, that's once every 2 minutes. Okay. I've seen a lot of people with 60, sometimes 90. Can you imagine? And they're struggling to sleep. They're struggling with breath every minute. while they're sleeping, every single minute. And
And
their desaturation low, which is called nadir, that nadir score, which is the lowest score, I've seen it go down into the mid 60s. I've never seen it as low as you're talking about. Uh,
well, it depends. I think it depends like on the time. So let's say you go down 20 times, right? But how far down does your O2 sat go? It can go down for a really low amount and it may not last. What's the interval? Does it last 4 seconds, 2 seconds, 1 second, half a second? So I think
it's
that's
usually
also important, right?
it's usually not measured unless it does 10 seconds. That's the way
Unless 10 seconds. Okay.
they're set at 10-second intervals.
Okay.
You
Okay.
have a 4% desaturation is measured for Medicare, and a 3% desaturation is rated for everyone else, all other insurance carriers.
But can't
So
they
it's
be
three.
also really large? Can they go down to like a very
Yeah,
large O2
yeah.
sat?
Oh,
Okay.
yeah, they can
So
do it.
that's important too. That's important too.
I've seen mine hit 80 when I was not being treated, and so that's very, very bad. You generally start crash cart work in the hospitals when people get below 90, uh, or get at least 88, and then they're going down that far that they're in the emergency mode.
But for
You
how long?
cannot.
Let's say 80 at what? How long? Like for 10
Well, if
seconds?
it's maintained there. No, 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 no. I'm not talking about that. We're talking about the average getting that low. So
Okay.
let's say, you know, uh, let's just say that I get 88 and it stays there. I can't do that by just holding my breath. If you hold your breath and check your O2 sats, you cannot you cannot get below 90. I can't do below 90. It's impossible for me to do that. And yet people do it routinely down to 85, 83, 80, sometimes
That's
in the
interesting.
70s.
Interesting.
And it's just absolutely astounding to me that
Wow.
anybody could do that. And they don't know it because they're asleep. Okay.
It's like
Their
going
body
back down to
knows
the
it.
bottom of the pool, holding your breath, but you're holding your breath longer than you would normally.
Well, you'd
Isn't that right? A
pass
little
out.
bit almost,
You
right?
would
Yeah, you
pass
pass
out.
out, right? So,
Yeah,
well, you
you'd
are
pass
passed
out.
out. You are
Yeah,
passed out.
that'd be
Yeah.
bad thing. So that Supreme Court justice died in Texas
So
uh,
sad. Yeah.
from sleep apnea, and he didn't wear his CPAP that night. I think that's what happened with him. But there are other people who have died from sleep apnea in their sleep. But the thing is, Locke, when you get into an apnea event, it raises your blood pressure because
Right.
cortisol is
Sure.
released. All kinds of things are done. Uh, they upset the ghrelin and leptin hormone levels. There is all kinds of things that happen that causes you to gain weight, and then when you gain weight, you also can't lose the weight because the sleep apnea uh, keeps you producing cortisol, and that weight cannot come off. So people who can't lose weight need to look at whether they have sleep apnea or not, impeding their ability to lose weight. And heart disease and kidney disease is mainly a function of, well, great deal of it is due to high blood pressure, damaging the heart, nicking those veins, and
Wow.
causing the accumulation of plaques because of that ejection and that power that those fluids are going through your veins and arteries, mainly your arteries. And so you got to get that under control. The kidneys are being damaged, and so I already have some kidney damage from the time that I didn't get it under control, but at least it's remained stable for many, many years now. So
Are you saying that you
it's
can affect your if you have sleep apnea and your spouse is being affected by that, that it could affect them too,
well,
systemically?
yeah.
Wow.
Essentially, how it affects them is that they're constantly being disrupted and they can't get into deep stages of sleep. So they're not getting the physical restoration and the mental restoration that they need in their sleep. One of my assistants in my office, I treated her husband. He came in, found out he had sleep apnea. I put him in an oral appliance. We sent him home that night. She came back the next day. Her, not him. He was treated. He came back to me and said, "Oh my gosh, I had the best night's sleep I've had in years." And she says,
Wow.
"I had vivid dreams." she had a dream deficit that she had to make up. So she was into very vivid, sometimes almost too vivid dreams because she had to catch up on all the lack of dreaming she had in her REM stages of sleep, because that's where most of the dreaming is done, in the REM stages of your sleep. Some is done in the deep stages, but a lot of it's done in your REM stages.
I never thought of that. I never thought of
Yeah,
that. I mean, I understand the sleep deprivation, but I never understood that the health can
yeah.
be affected by that.
Well, yeah, definitely. And so her
Yeah,
health
that
was
makes total
affected
sense,
by that.
right? Makes total
Yeah,
sense.
you're harming your spouse or whoever lives in a close proximity to the noise that you're making. I didn't know that either. I feel bad about it actually.
Yeah, I do
Um,
too.
yeah, I
Yeah.
do. I do.
Yeah. Oh, that's really
Uh,
powerful to know that, isn't that,
well,
Locke?
we need to educate.
Yeah,
Yeah, we need
yeah.
to start treating our children now. You got to get them away from the sugar and the soft diets and all these things that are impeding our growth of our faces. If you look at children now, they've got narrower and narrower faces. They got receded chins, look like mine, and um, and we can't. We got to do something about that. And
So
there
quicker
are.
is not always better. Removing what bicuspids is not always better for speed. Sometimes they do it, and
Well,
it's like
I don't recommend it at all.
I
Now,
know
I might recommend it for a severely
class three.
bimaxillary protrusive person, but
Yeah, yeah,
severely bimaxillary protrusive, maybe. But other than that, I don't. Okay.
yeah. Makes sense. That makes
Yeah.
sense. So airway trumps aesthetics in that sense, right? Yeah, in
Well, of
terms of
course,
smell.
airway. Yeah,
Yeah,
no,
if you can't
no.
breathe,
Here's
it
that's
doesn't do any good.
it's a good cautious. I'm glad you brought that up, Charles. Just because we get somebody's airways all open, doesn't mean that their sleep apnea is going to be cured. Doesn't
Well,
have,
that's true
it
too. But
doesn't always happen.
yeah,
Most people get better, but not everybody gets better. Nothing works on everybody. Nothing.
I guess what I was saying is that don't make the teeth all straight if you don't get to breathe, is what I'm trying to say. Like, don't take teeth out and
Yes.
make it all straight if you can't breathe. Airway is the most
Well,
important, you know?
yeah. The
Yeah.
philosophy was when I was going through school in orthodontics, and I got treated in orthodontics in dental school, was that your jaws are small. This is genetic. It's not genetic. It's not genetic at all. It's it's an epigenetic malformation of your face. It's it's been caused by forces that aren't supposed to be that way. But anyway, when I went to school, the way you lined up teeth was you took the teeth out in order to line the teeth up to
Right,
the
right,
jaw space.
right.
Now we teach you expand the jaws as much as possible to accommodate the teeth.
Correct,
Different philosophy, different
correct,
philosophy. And I like it better.
correct.
And it looks better too. I mean, we just plain look better if we do that.
Oh, broad smiles are nice, right? And Julie
Well,
Roberts,
you have
Take
a
a
long
smile, right?
face too, Charles. You have a long face too.
I do.
Uh,
Yeah, and
yours is,
that's why, I probably
did you
have
have
the apnea so
bicuspids
good.
removed and you had, what did you have done,
No, I had
Charles?
no bicuspids removed, but I
What
have
did you,
a higher palate, same thing as you.
yeah, I have a high palate.
We both have the same thing.
Yeah.
So,
All right.
and
All right.
and and consequently, because of that, I had a little wear on my back teeth,
Yeah.
right? So
Yeah.
it's okay.
Yeah. Yeah.
But
I think that I think the conversation that we have is very very easy for a lot of dentists or professional healthcare providers to understand. I just want to go really quickly and if I can
Yeah.
explain this in a very basic
Yeah.
concept for the general audience, and hopefully
Yeah.
you can help me to whatever I missed. So the we're talking about sleep medicine and the sleep apnea. What we're talking about the condition that whether you are a child or an adult or an older person, if when you don't have enough oxygen into your body, the
Right.
way your body works is, each of your cell have the capacity of receiving a certain amount of oxygen supply, and it help to, it's like a fuse. It activate and it burn the energy and it create the activity that is help you to function on each individual level of your cell, whether it's your
Mhm.
lung cell, your brain cell, your heart
Right.
cell, your kidney cell. Each of your cell
everything.
have a ability to receive a certain amount of oxygen, and when you don't have enough, the level of oxygen supply in your body. And usually it's caused by the airway space. And that's what we're talking about, the sleep apnea and destruction. And because you both are faith-based doctor, I want to ask you, why God creates the problem, or you mentioned about the epigenetic factor. Is it caused by the negative
Well,
force? And what do you mean by that?
epigenetic.
Yeah,
Um, so what's happening is this. I list 14 causes for our shrinking faces in modern society, and it's overprocessed food. It is
Yeah.
the absolute abundance of sugar and fructose. It is allergies. It is all kinds of things that are interfering with the natural development of our jaw. Your tongue generally allows you to push out on the teeth. In other words, it widens the arches. So the lack of breastfeeding is another problem that we have. It's not widening our jaws like we should. And even the bottle feeding and the pacifiers that we're using are harming the development of our faces.
That
And
I
a
know.
number of things that are going on that we need to fix. And there's 14 of them listed in my book that are
Mm.
causes for this. Okay. Um, Modern society has this. Now, let's just take for one example, Locke. Our primitive man had about 20 bacteria in his gut that would digest plants. Okay. Now, in modern society, we have about, I think there's five to six or eight, I can't remember what I said in the book, in farmers that can digest plants. And in city dwellers, it's down to two. So we
Mm.
don't have the bacteria in our gut to digest plants like we used to. Okay. So those things are affecting everything in your body because the bacteria has been changed, the microbiome has been changed, the amount of antibiotics we get are also destroying our body's ability to grow properly. So many things are going on, and it's all going together. We talk about the pollution in our water supply, the plastics, the xenoestrogens, all these things are talked about in the book. Okay. And that's what's going on. It's not God's fault. God, God gave us good plants, good nutrition, and the ability to grow a good face. We have messed our faces up. And the problem is we're getting so used to seeing our faces like this, we're changing our perception of beauty as we get older. So it begins to look normal to have these shrunken lower faces, these narrow, shrunken lower faces like I have. Okay. It's not normal at all. It's not normal. And we got these open mouth, and some kids will, laugh about it. You're a mouth breather. Well, it is a sad thing to say, but it's also a problem. The adenoids and the tonsils shrink, actually swell when you mouth breathe. When you're mouth breathing, those swell.
Wow.
That causes the earaches. Children have earaches all the time. Now, here's the problem: is we have 6 to 8, sometimes 10 respiratory infections per year in children. All that time, they can't breathe
Yes.
through their nose. So when their mouth is open, now you cannot develop your jaws properly. That's what's going on. Kids are not getting their development of their jaws because half more than half the time their mouth is open because of respiratory illnesses, allergies, whatever it
Crazy.
might be. It is a crazy combination of things that's going on.
Are you
That
saying that
help
can
you,
change the
God?
structure? Is that changing the structure of the face? And
Yes,
then
it
how?
is. Mouth breathing changes the face of your face, the direction of growth of your face. You will not develop
So,
you are not, Charles, you have not developed your genetic potential. Your face does not look like it's supposed to. Neither
amen.
does mine. I don't know about Locke. I
Yeah.
mean, Locke might have grown up in a better environment than I did, but his face doesn't look as deformed as mine does.
No,
Okay.
it's funny. Hey, right? That's why he's so smart, right?
Maybe that's it.
But maybe that's it. But
Yeah.
we
But
that's why we're out of the box thinkers, though, right?
we're
Uh,
so when I see somebody walk in looks like me, I'm already thinking sleep study.
that's funny.
I'm thinking it.
Wow.
I'm thinking it. And I see their chin receded, and I see a turkey neck, I see a forward face posture, a
Certainly not.
forward head posture, I'm going to think sleep study. If they're overweight, I'm going to think sleep study. You know, and it's like, why isn't that automatic for all practitioners? Why isn't that?
Because they're
Well,
not
it ought
trained
to
to
be.
think that way. They're not
It
trained to look at
ought to be
that.
automatic.
Okay.
And I know I'm an evangelist about this, but I
That's
don't think
okay.
it's a bad thing. Why not rule it out? I mean, if I'm wrong, prove me wrong. That's all you have to do,
Sounds like we need to have a symposium on this at some of the medical conventions.
or whatever. I mean, I
Well,
hope the book
I don't
does
know.
that. I hope the book helps.
Well,
So, so
if they read it,
Doctor,
they will read it more than they.
Yeah, go ahead. Go
so
ahead.
Doctor, Dow, do you think that dentistry in dental school we should have like sleep medicine at the specialty as a
Absolutely.
separate specialty?
100%.
I do
100%.
too. Medical doctors get about 15 minutes of sleep medicine while they're going through school. It's almost nothing. Dentists get nothing. Uh, it's pathetic what we're coming out with. Nothing.
How about my
Not in
school?
dental school, not in medical school, almost nothing in nursing school or I know it's nothing in chiropractic school. Trying to break into that. I'm trying to break into that profession. I think it's an untapped profession for handling sleep apnea, and many chiropractors are DOT
I would agree.
physicians. So we got truck drivers out there driving around sleeping.
Yeah, that's scary.
Okay, let's fix it.
Well,
Okay.
Musk is handling that with autonomous cars, so that's going to be a problem. But yes,
Yeah,
it's
that might help if we
going to be
get
worse
them
because
done.
they're going to be sleeping while they're driving. So it's going to be worse. Okay, so
I'm ready for an autonomous car. I'd take one.
I
Yeah,
don't know about that. I'm a
I
car guy.
oh I like to drive sometimes, but if I'm just going from one place to the other, I don't know. I could, an autonomous car would be fine with me.
yeah, the
I still
self-drive.
that person,
Um,
but
Yeah.
I
Yeah.
use it a lot. I use it every day.
Oh, do you? Okay, good.
Yes. So let me ask you this. Just to for the quick summarize of what we talk about, if you are a dentist, because we are most of my audience are dentists and doctor, how do you go about to if you're a dentist, how do you work with a physician or how do you work up your case? If you have some training, what are those options for the patient and surgical standpoint and therapy. Can you just put in summary perspective, what do we know so far and how can we help patients and what are the chances of successful of treating these case? Would it be improved more than
All right.
60%, 80% outcome? What are we looking at? Thank you.
Yeah. Well, first of all, we must work with the physicians. Dentists cannot and are not allowed to diagnose obstructive sleep apnea. You have to get a physician's prescription and diagnosis. That's just fine with me. I don't want that. I don't want to do that anyway. That's not my field, but we can help tremendously assist the medical profession in finding these patients and getting them treated with treatments that are effective. And by the way, fixing sleep apnea in children is as simple as orthodontics,
right,
expanding the arches using expanders and Invisalign or any kind of clear aligner therapy. So we can do that, and that's shown in the book. So why not help them? I think the physicians need to work with dentists, and the dentists need to work with physicians, and we all can also work with the chiropractors. So the next question was, where do they get the training? Dentists can get training through my online sleep training at sleepbalanceacademy.com. There is a full course, 41 hours of CE credit there, and we teach not just oral sleep
and
appliances,
it's
but
approved too. It's approved units,
all
correct? Yes.
it's pace approved.
Okay,
All
perfect.
these all these
Transdigital
therapies I
dentistry.
talked about are
Okay.
talked about in that, rather than just sleep appliance, which is what dentists used to learn when they were talking about sleep dentistry. All they learned was sleep appliances. That's not true anymore. And then that's why they made us DME providers, because a DME provider just supplies a little piece of hardware. I think that's a big mistake, because now when you're treating the tongue and the palate with a laser, when you're doing expansion, you're not dealing with just a DME, durable medical equipment. situation anymore. You're dealing with a medical procedure that's treated by dentists. Okay. So you get your training here at Sleep Balance Academy. Look under enrollments lock, enrollments, and then you see the purchase the full course. Full course is right there, and that's how a dentist becomes trained in dental sleep medicine through the Air Institute and Sleep Balance Academy. Okay, that's where they
What
do
about
it.
the general public? Do you have one for the general public at all, where they can get like just basic information?
Yeah, they can go to onlinehomesleepstudy.com. Once you hit that one, go to online home, just type it in onlinehomesleepstudy.com,
Okay.
and the patient could get a sleep study there or the circle ring.
Now, when you say
And
sleep
that,
study there, would it be a take-home test or is that something else you're talking about? The ring, I
no,
get. Show the ring too.
we send the ring to them,
Okay.
and
That's really
then,
good. I don't know if you've seen
yeah,
that lock, but it's great. You can go to the ring.
online home sleep study. No, not there. Go to onlinehomesleepstudy.com. Can you just type it in, Lock, at the top,
Online home sleep
uh,
study.
or you can go to drsleepshow.com if you want to. Dr. Sleep Show, and that'll bring you right to it.
You can share your screen. You can share your screen if
All
you
right, sure, I'll show it to you.
yeah. Yeah.
So let me show you to that.
Show the ring too, if you don't mind.
I will. So online, okay, excuse me. I'm just going to check this here online. Here you go. So this is onlinehomesleepstudy.com. Let me get that up here. And in here, this is where the DOT drivers can get their sleep test. I had two uh, airline pilots, airline pilots, two airline pilots this week apply for a sleep study, and we have
Can
ones
it
that
be
are
discretionary
qualified.
though? Because if they get diagnosed with apnea, nothing's done. That's a problem. Can they do it discretionarily too?
Well, they're required to do them though, and some of them are
They are
required.
required. They are required
This
now. Okay. Okay.
well, for instance, this well, a DOT truck driver is different than a pilot, but you can see that we have a this is called the Z machine. That's just what we use for pilots. Uh, and then we have this is called the night owl, which is a one finger sleep study, and that can be done at home.
What's the effectiveness of that? The finger versus because the one that's on your head falls off all the time. So what's the
Yeah, the areas I don't use that as much as I used to. That's
it
called the
falls
areas
off.
right there.
Yeah.
Yeah. It's a good sleep study though, real good. And it measures the nasal airway. Um,
But
the,
it doesn't measure snoring. It doesn't measure all that how far it dips. It doesn't do a lot of that stuff, right? So for me, it was
no,
ineffective.
no, it does measure the dip in AHI.
I didn't so I
The
don't know.
sleep image is is a nice ring. I use this especially for children, but the problem is not all insurance companies recognize this sleep study. Okay. And then this is the circle ring, and this is the pulse oximeter, which you can use at home. I think it's better than an Aura ring because it has no racial bias. In other words, all most of the ones on the market have been shown to be racially biased to those who have.
It also explain the difference. The Oura ring is only like so much. This is continually monitoring versus like 10
Yeah,
minutes of
this
time.
one monitors every second, where the Aura ring is like once every 15 minutes. Now they have a new generation ring that's supposedly better, and I don't know much about the new ring that Aura has. Um, but anyway, that's a great home use product that is not a sleep study. In some countries, it is, but there's no subscription to that one. Once you buy it, it's you can do it as many studies as you want, and they're free. Okay. We have also the INAP, which is a negative pressure device. Instead of a CPAP, this will pull your tongue forward and your soft palate forward. It sucks it forward. It's called INAP. We helped introduce this to the country.
Is that go on the tongue? Does it pull the tongue forward?
Pulls the tongue forward. Yeah, pulls the tongue
But the,
forward and the soft palate.
how do you
Opens
fit the
up the
tongue in
airway.
there? How do you customize the tongue to fit in there?
The suction pulls the tongue up to the roof of the mouth, and then it pulls the soft palate forward. So
Nice. Yeah,
there is the devices. That's the oral device right there. Okay. Okay. And so that sucks in the air. when the air is sucked out of your mouth, the tongue flies up to the roof of the mouth where it's supposed to be.
Interesting.
Okay.
Huh, I'm trying to figure
That's
that
called
out.
the INAP. And then there's the nasal dilator I told you about. Okay.
Those are great. I've used those. Those are
Those are
great.
those are really nice.
Yeah.
So persons can order the sleep studies here and and uh, and then have them shipped to them, and then you ship them back. Okay.
What
So
about your
that's
nasal spray? What about that? That's
here. That's right here. This is the one, the nasal
what does that
spray.
do?
And that shrinks the turbinates in your nose and helps make it cleans the nose and shrinks the turbinates. It kind of opens the airway or promotes the opening of the airway. Okay.
So it's like a neti pot, kind of a little bit, or kind of with the saline in it.
I think it's better than Nasipot because
Yeah.
I don't think as you should use a saltwater solution in your nose for more than 2 weeks, and then you should stop. Whereas it's this one you can use every day.
Okay.
This is the so that's the nasal cleaner, and it's just come on the market for a short while, and we're going to be introducing that to a number of different companies.
Yeah, that's exciting. That's really
Yeah.
exciting.
So that's what it looks like for the you can read the general public can read this information here. There you go, Locke. I gave you the screen back.
Thank you so much.
Yeah.
Let's see. Did I go back to? Yeah, thank you so much, Dr. Richard Dowse
Yeah.
and Dr. Gerald Durace. We spent almost exactly an hour and 6 minutes.
Okay.
I'm sure we
Goes by
uh,
when you have fun, right? Yeah.
I'm sure we're going to be able to catch up more with a lot more information for especially dentists that are curious about getting to know about the course, the education, the information that Dr. Dowse can uh, teach, share, and educate us with his years of experience in sleep medicine as well as other oral medicine uh, topics. I'm honored and really appreciate the time that we have today. You have any last minutes for your audience? Please share with us. The simple way to obtain this information. I know that there's a book that you wrote, also the website.
Yeah.
Just quick information that Dowse
Yeah.
and Dr. Dury.
Well, the honor is mine, Locke, I really value the relationship I have with you and Charles. Um, yeah, the
Same.
book is on Amazon. It's called Beautiful Faces: the Architects of Enhanced Attractiveness and Improved Human Breathing. It's on Amazon. It's a 380 some page book with over 500 footnotes. Um, and it has lots of pictures in it to help you understand what we're talking about. I tried to explain uh, the scientific words so the public could understand it. I hope that it helps patients as well as physicians and dentists, all health practitioners, to advance the needed advancements we need in this field of study. Otherwise, if you want to know more, just contact me through the website, sleepbalanceacademy.com or onlinehomesleepstudy.com. Okay.
Well, I just want to say, first, I commend you for what you're doing. Second of all, you care. You care about, you're going to third world countries and doing care there. You know, Alok is doing that, is educating people. You're delivering something that is a legacy for continual, for improving lives. There's a lack of education, there's a lack of knowledge, lack of implementation. So I think all that what you're doing is fantastic. You fueled me like a Kindle right now. I feel like there's been fire on me now with oil, lighter fluid because I want to help
Yeah.
because I see this now. I've had a problem, not knowingly, by the way. And what I know now is lack of awareness that people don't know about this. And why not try to make this thing in the world a little better place by educating them? And I have some ideas on how we can do that. And I would love to be part of it. I know Lockwood. I know he would. So
Yes.
yeah, I'm excited to see what can be happening here. And you already have the systems in place and the knowledge. All that has to happen is be implemented. That's
Yeah.
it.
Thank you.
So
Thank you.
really, really exciting, you know. So thank you for
Appreciate the help, you too.
yeah,
Yeah.
I,
yeah,
I
yeah. Very good.
Charles, for the audience to know the background, V formation, can you talk a little bit for my audience? What do you do?
Yeah, I mean, I will, thank you. What I do is that every company, I find there's three successful things. One is the company has to have a purpose with what they do. They have to be passionate about what they do, and they got to care about people. Because without those three things, it's nothing. If you chase money, nothing will come. If you take purpose and principle over profit, things will come. Richard does not need to do this. He's doing it because he cares about people. Okay. It's a purpose driven company. He's passionate about it. He cares about people. That's the three P's to success. Okay. I think God blesses those that give more than receive. Okay. And he's giving in order for people to receive health and to be united. So that's what I do. I fund companies. I try to fund companies that are impactful companies, companies that are making a difference in the world, not just monetizing, but companies that are actually trying to make a difference. And I'm in the health technology space specifically, although I do all different kind of verticals. And the reality is that we don't always have the secret sauce to make success. And if someone can help someone else, either from a new advisor, or another C-suite level person, or funding, or whatever it needs, branding, if something's a good company and they just are missing the wrong piece to a puzzle, and I can drop a little piece in to make that puzzle go and pop it, then that's what I like to do. I like to solve puzzles and put a little piece in action in there, and hopefully God blesses those that have those little pieces that comes in, and then their whole thing that they want to do comes our heart is the most important thing, like a body, right? The heart is faith, the heart is love, right? The next thing is the mindset. Do we have the mindset to get there? The outcome is a result of all those things at the end. So Dr. Zhao has a good heart. You have a good heart. I'm working on my heart, okay? But I think that with that heart and with that passion and that conviction and that drive, which is pretty evident by both of you guys, then the results will happen automatically. You know, so that's what
Super,
I do in a nutshell.
super
Yeah.
beautiful, Charles. So, how do people contact you? Through LinkedIn, through
Yeah,
for information?
LinkedIn, LinkedIn is one way to go. Uh, Through my website. That's another bformationconsulting.com.
Or they
But
can reach out to me.
I'd say probably LinkedIn, or through you, but the filter. But through you is fine. Then we can directly know through either of you two actually. But yeah, LinkedIn is good. I don't always get those messages and emails stuff like that. But yeah, that's probably the way to go. It's through you guys, or happy to share my contact information. Both of you guys have my number, and then go from there. And I'm here to serve, just like you guys. I'm not here to serve myself. I'm here to be a servant leader, and to make a difference in the world. Money is not the answer. It's all about fulfillment in life, right? It's about contributing and creating a legacy that it's a legend that lasts a long time and a difference. Because we're here to help each other, whether it's people that are rich or people that are poor, right? It's
I
fundamentally based on that. So yeah, that's how to get a hold. You can look at my website, but more importantly, people by people, right? And I'm just surrounded by good people, so like
Man,
you guys.
I
Yeah.
am
Yeah.
so blessed to see the change, the transformation of Charles, and
Well, that's because of
how
you.
look at how Charles talking.
Yeah.
That's powerful. And Dr. Dowse, if you need any help, Charles and me definitely will make it
All right.
happen.
Love to.
Yeah.
Love to.
Thank you.
Yeah. Thank you so
Thank you.
Thank
much,
you so
Locke.
much.
Appreciate your time.
Have a
Okay.
good one.
Take
All
Take
care.
right.
care. God bless
All
you.
right. Very
God
good.
bless.
Iron sharpens iron.